everyone to the Let's Talk Thyroid podcast. This is episode 126, and I'm joined by Dr. Vincent Pedre from Miami. So we worked out, opposite sides of the world, which is often common with some of my guests. But Dr. Pedre is all about gut health, and so that's what we're going to be talking about today. In particular, we're going to be talking about the connection between gut, brain, mood. How we feel, in our emotions and that connection to gut health. So that's where we're going to dive in. But I want you to know that a little bit about Dr. Pedre first. So he, I like this in his little bit of information he said about him. He believes that gut way is the gateway to excellent wellness. And, I think that we hopefully all of you listeners know that by now, because we do touch on gut health on and off over the show, but we're going to be diving into that deep. And he's written books about gut health, the Happy Gut and the Gut Smart Protocol. So you want to check those out. There's protocols that go along with that. I was having a read through the Gut Smart Protocol this week, and it's really practical. So like if you want to work out, do you have a gut problem? There's questionnaires, there's meal plans to follow. Really practical. I really like that. He's been on lots and lots of other shows like Women's World, Fox News, ABC, CNN, MindBodyGreen, Dave Asprey, Yahoo, and the Let's Talk Thyroid podcast. So happy to add that one to your list. And I know actually too, Dr. Pedre, that you have been on a couple of my other Thyroid Friend podcasts, because I had a look at that. Dr. Emily Kybert and Eric Osansky. I noticed that you've been on both of their shows.
Absolutely, yeah.
Yeah, so I know too, just from following some of your work, that you do really have a lot to say about thyroid health. So I'm looking forward to really getting into that with you today.
I'm excited to share some really valuable tips and pearls of wisdom with your listeners that I think they're going to have a lot to take away from this episode.
Yeah, that's great. And look, what I would say, because I was looking at the topics that you were covering on some of those other thyroid podcasts, and I don't want to go over those things again. So if you're listening, go check out those podcasts because they're great podcasts anyway. Emily and Eric have been on this, on this podcast. So if you've listened to their episodes and like them, go follow them. And if you like this one, go listen to those other conversations, because I think this is one of the things I really like about the thyroid holistic health space is that we're all just one big community. So,
yeah,
I think why recreate the wheel, right? So, Dr. Pedre, all around gut health, maybe we could start, because I do want to get quite quickly into the gut-brain connection. But can you explain a little bit about why gut health is so important for someone with a thyroid condition?
Gut health is, first of all, central to everything. The way that I can best describe it is that the gut is like the roots are to a tree. You can't imagine a tree living without its roots. You can't have a healthy gut body or thyroid without a healthy gut.
Mm-hmm.
And there's a lot of interconnections between the gut and the thyroid at many different levels. And I'm sure you've discussed this in your podcast, how thyroid hormone is produced. The majority of thyroid hormone is in the form of T4, which is more of an inert form of thyroid hormone. And T4 needs to be converted into T3 in order to be activated into the type of thyroid hormone that has the effects that we associate with the thyroid: metabolism, energy, mental sharpness, all of those things.
Mm-hmm.
And if we group the liver as part of the entire gut ecosystem, then 60% of that conversion of T4 to T3 is happening in the liver. But there's a whole 20% that is being converted by the gut microbiome from T4 to T3.
Yeah, it's a lot.
So sometimes we talk about the gut microbiome as being almost like an accessory organ outside of our bodies. The gut microbiome almost acts as another endocrine organ that is helping our bodies perform its functions. And 20% may not sound like a lot, but if you lose 20% production or conversion of T4 to T3, that could be the tipping point between feeling good and feeling not so good.
Mm-hmm.
So right there, we have a very strong connection. The other connection has to do with an enzyme that exists all along the gut lining that's called tissue transglutaminase. And that enzyme is connected to the thyroid and to gluten, wheat
Uh-huh.
gluten.
Mm-hmm.
And
Okay.
tissue transglutaminase is actually an enzyme that's found very predominantly also in thyroid tissue. Well, when people are either sensitive or have celiac disease, they can sometimes form a gluten tissue transglutaminase chimeric molecule. So imagine the two combined together,
Uh-huh.
like those Greek chimera, like what is it? Like a lion and has a
Oh,
tail of
like
a
a lion and a bear or
dragon.
something,
And
Okay. Yeah.
so the body will see the gluten molecule attached to the tissue transglutaminase and confuse it as foreign, then create a reaction against tissue transglutaminase, our own
Mm-hmm.
enzyme, and then it will go and find it in other places. Well, where else is it going to find tissue transglutaminase? It will find it
Mm-hmm.
in the thyroid. So people who develop a
Mm-hmm.
sensitivity to gluten in the gut are potentially going to also cross react with thyroid tissue. And that's why there's
Mm-hmm.
such a strong interconnection between sensitivity to gluten, autoimmune thyroid disease, and activation of the immune system causing the aggravation of this autoimmune thyroid disease. And we also know that autoimmunity starts in the gut. That's
Right.
Dr. Alessio Fasano, an I think he's a Harvard researcher that
Mm.
determined that there are three components to autoimmune disease. And one is a genetic predisposition. The other
Yep.
one is some sort of trigger, environmental trigger, which could be a bacteria, could be food. In this case, he was looking at the connection with gluten. And then
Mm-hmm.
you need one more factor. So it's like a three-legged stool, the three things that are needed for
Mm-hmm.
autoimmune disease to be able to thrive in the body. And the third factor is leaky gut. So again,
Uh-huh.
we're come back to the
Yeah.
gut and how important and central, because that the gut is
Mm.
that root system. It's the anchoring point for the body. And if the gut is not healthy, then it's like the lead domino in one of those long, those domino trains where you tip the first one over and then you cause a whole host of problems in the body.
I think one of the things I heard you on a podcast with Dr. David Perlmutter, and I'm going to come back to him in a minute, was you started to talk about leaky thyroid, and which I'd never heard that term leaky thyroid before. Can you tell us a little bit more about, what is leaky thyroid? Is it a thing? Tell us a bit more about that.
This is a novel concept because if you
Mm.
think also the thyroid tissue is protected, right? And it's got an outer layer. Now, if you can think back to what I was talking about, the tissue transglutaminase and also
Mm.
other types of enzymes that people with um, autoimmune thyroid tend to get antibodies to thyroid peroxidase, which is another enzyme produced in thyroid tissue, as well as thyroglobulin. But these are enzymes that are found inside the cell. So why are they getting out? And why is the body able to then see it and get sensitized to it, thinking that it's foreign? And part of that is the breakdown of the thyroid and causing leaky thyroid. So we know about leaky gut, but we can also develop leaky thyroid, a leaky blood-brain barrier,
Mm-hmm.
and that exposes the body to proteins that it should not generally be seeing and
Right.
can lead to autoimmune disease.
Yeah, excellent. Yeah, thank you. I was like, oh, hold on. I'd heard of the leaky brain, leaky gut, hadn't heard of leaky thyroid. But so, yeah, thanks. The body's so interesting, isn't it? I mean, you're the medical doctor. Obviously, that's your thing. But just all the interconnections. And
The body
yeah.
is like an onion, and you just start peeling the layers, and you just
Mm,
find more layers and more layers and more layers of intricacy and interconnections and cause and effect relationships. That's what makes medicine both a science and an art.
yeah. And I think the thing I've found really interesting about having, Hashimoto's and like thyroid health just impacts everything. So you do, you know, all those different layers apply when you've got a thyroid condition because it just impacts every cell, every system. And so, yeah, just as a non-medically trained but really curious person and passionate about my own health, that just learning about all those connections. And it is like layers, because I've been at this for 20 something years, and there's always another layer. Yeah, it's really, yeah. So thank you. Every conversation I have just, for me, peels back another layer. Um,
There's so much to learn.
mm,
There's always so much to learn, and I think that for anybody who's in wellness care, it's important to maintain a certain sense of humility, because our knowledge evolves, and sometimes
mm,
what we thought was true can change over time, as we've seen over the last 20 years. Medicine has changed in leaps and bounds, and our
mm,
understanding of mechanisms of disease and just the significance of certain things that had been overlooked for so long
mhm,
has really come to the forefront. And I think and especially with, just having podcasts like yours, like more and more people are getting educated and re-educated on what the potential truth is of where disease comes from and what can you actually do to help yourself.
Yeah, absolutely. It's so much more empowering now than it used to be, because I think we can, have access to so much really great information. And, I think we all need to take that personal responsibility. And I mean, listeners of this show will know I'm always saying, like, be your own experiment. You've just got to give things a try, give things a try. Um, Dr. Pedre, I want to ask, so I first became aware, or my first memory of becoming aware of the gut-brain connection was when I read Grain Brain by Dr. David Perlmutter I think about 13, 14 years ago. And that was like revolutionary to me to understand that there was even a gut brain connection, and then the
Yeah.
connection in with grains. That was probably the final nail in my gluten coffin. Was reading that. But just, I mean, I think people are still learning that there is a gut brain connection, and that's going to lead right into where we want to go with the, mental health mood kind of connection as well. But I mean, seemingly unconnected. The gut and the brain don't seem to be connected, but they are. So can you explain how they're connected?
It's I think it's one of the most important interrelationships in the body. And we often talk of the gut as the second brain. The enteric nervous system has about 500 million neural connections. Still not as many as the brain, but still quite significant for an organ system outside of the brain. And that enteric nervous system can fire separately from the brain. So it almost has its own brain. That's why we call the gut our second brain. I like to think of the gut as our first intuitive brain, because I think there's a lot of nonverbal sensing that happens through the gut that gives us a great deal of wisdom. But if we think like, well, how are the gut and brain connected? The best explanation of that is the vagus nerve. And the
Mm-hmm.
vagus nerve is called vagus. It comes from the Latin lazy, almost like a lazy river. It is the longest nerve in the body, and it innervates all of the internal organs. And as it comes down from the brainstem and crisscrosses here on the neck on
Oh, where
both
your
sides,
thyroid is.
yeah, right where the thyroid is
Mm.
and the vocal cords, and
Mm-hmm.
then innervates the lungs, the heart. It deals with heart rate variability, and it's the firing of the vagus nerve can be controlled by how we breathe. and then it innervates the entire digestive system and controls a lot of important functions within the digestive system. But what we know is that the vagus is actually a two-way street. And if we think of it as a superhighway, well, it's got more lanes pointing up from the gut to the brain than lanes pointing from the brain going down to the gut.
Uh-huh.
So it's probably about 70-80% of the lanes are actually sending signals back to the brain, giving the brain a read on what's happening with the internal organs. And the gut, the digestive system being one of the biggest systems there, that becomes really significant because the vagus nerve can modulate, basically change the way the brain is functioning in a person based on how it's firing or not firing.
Wow. Wow. That's a lot. 70 or 80%, heading in that direction, heading from the gut to the brain. That's quite disproportionate, isn't it, to what so it makes you realize that, so the signals it's getting from the gut need to be good for your brain to function well. Is that a
Yeah,
fair simplification?
and one way to think about it is that vagus nerve needs a certain level of background firing in order to be active.
Mm-hmm.
And I used to like to say like it's a dial tone, but I don't know if people remember when we had actual phones
No.
and you picked up a phone and there was a dial tone on the phone that told you the phone is alive. But it's very similar to that. That vagus nerve needs to have a certain level of tonicity, or it's firing on a regular basis. And when it loses that tonicity, then you can get things like constipation, like loss of appetite, like inability to digest food well, like feeling like food sits like a rock in your stomach. And anybody who's listening, maybe you never heard of the vagus nerve, maybe you never knew that there was a connection between your gut and the brain, but anybody who's listening has had a major stressor, a major disappointment where they felt sick to their stomach, maybe even nauseous, lost their appetite, and couldn't eat, or if they ate, like could only eat a little bit because things sat poorly in their stomach. Maybe they find out that their husband cheated on them, or they're going through a divorce, or they just lost a loved one unexpectedly. Well, all those things connect to the vagus nerve and they will reduce the firing of the vagus nerve. So when we're talking about like what does vagal tone look like? Well, vagal tone looks like normal digestion, feeling like your food moves down easily, not getting constipated, like being able to break down your nutrients properly because the vagus is controlling stomach acid secretion, the secretion of digestive enzymes. It's helping to stimulate pancreatic secretions. It's helping to stimulate the peristaltic, the rhythmic contractions of the intestines. So the vagus is doing a lot of things in the background. And if the vagus is not firing properly, it's actually also connected to other conditions that are considered to be mental, psychological, like depression, anxiety, like not feeling feelings of lack of motivation. It gets a little more complicated and nuanced because there's this whole other branch of understanding. When I want to just kind of like paint the picture because we're talking about this vagus nerve, but what is it? It's part of the parasympathetic nervous system. It's the part of the nervous system that is all about rest and relaxation and digestion. It's where you feel safe, you feel secure, and thus your body's relaxed and you can eat a meal and your body's going to digest it well because your body's not trying to run away from some sort of danger. But when we talk about that, what we're really talking about is what we call the ventral vagal complex, which comes down the front of the body. But the vagus actually splits into two complexes, and one is called the dorsal vagal complex, and the other one is the ventral vagal. The ventral is the one that we associate with safety, security, calm, good heart rate variability, good digestion. The dorsal vagus is the more what we would call the reptilian branch. It's actually the more primitive part of the vagus. So it's the first part that evolved. If we look into like back in evolution, it evolved in reptiles and then was maintained in mammals. But when mammals evolved, they actually came in and the new part of the vagus branched off, that ventral vagus. Because if you think about like a lizard, do you see lizards cuddling together and like comforting each other? That's
Yeah.
not very lizardly
Yeah.
behavior, right?
Yeah. Yeah. Yeah.
But then you see monkeys and apes and koala bears and all that, and they cuddle. They're very nurturing, and in order to be able to develop that, we had to evolve that ventral vagus part that can regulate that sense of security. The dorsal vagus, when it gets activated, you can feel nauseous, you can feel dizzy. It's like having a
Mm-hmm.
syncopal episode, but it's also that withdrawn depression where you don't want to get out of bed, where it's hard to motivate, loss of
Mm-hmm.
motivation.
Mm.
And it's very important to realize that those two branches are both playing a role in the background. And either way, when that ventral vagus is not firing properly, then you can actually get activation of the dorsal vagal pathway, which is the one that leads to withdrawal, depression, like lack of motivation, all that. I'm
Mm-hmm.
sure anybody who's listening maybe has thought like, at some points I have felt that way,
Yeah.
went through a major life stressor, lost their appetite, and then they just can't get out of bed, or it's really hard, they're dragging. Well, that's
Mm.
dorsal vagal activation. And what I'm talking about is something that I talk about a lot in my digital course called Gut Brain Mastery, where I basically teach people how to biohack their brain through their gut. Again,
Uh-huh.
understanding that there is a
Yep.
very powerful gut brain connection. And we know that through the research that the gut microbiome is part of that connection, because by digesting foods and polyphenols, which are antioxidants in different types of foods like coffee and pomegranates, apples, they all contain these polyphenol bioflavonoid antioxidant nutrients that
Mm-hmm.
get broken down by our gut microbiome. And some of them get broken down and then converted, or amino acids converted to serotonin. And the vagus nerve has all of these endings all along the gut lining, and they get stimulated by serotonin that's being produced in the gut that then sends a signal to the brain. So, in a way, we could say that our gut microbiome speaks to our brain through the vagus
Mm.
nerve.
So if you're experiencing then, that sort of withdrawal, depression, hard to get out of bed, I mean, obviously there's a few different things going on, but if you're able to feed your gut microbiome in a way that is stimulating serotonin, then that's going to have an upflow effect onto how you actually feel. Is that right?
Absolutely.
Yeah.
So we know that there is this very strong connection between gut health,
Mm.
mood, energy, but a lot of
Yeah.
it can sometimes be through the gut brain connection. And we talked about leaky thyroid, we talked about leaky gut. I'm sure your audience has heard about leaky gut before. There's an
Yeah.
increase in intestinal permeability that increases the exposure to inflammatory substances that should stay in the gut that now get into the body, and they wreak havoc on our immune system. They scramble our metabolism. They cause weight gain. Also, when you have a leaky gut, you're also going to have a leaky blood brain barrier. And with the
Mm-hmm.
leaky blood brain barrier, now the brain, which has a protected circulation through that blood brain barrier, when that barrier becomes leaky, then the brain can also get exposed to inflammatory substances and toxins that get into the body, leading to things like mental fog, memory problems, depression, even anxiety. So things that we normally would think like only have a psychological or mental source, but actually is coming from other areas of the body that are affecting brain
Mm.
health.
Yeah, and we know all those things are thyroid symptoms as well, that brain fog, depression, anxiety, just inability to
And they can
concentrate. They're
they,
all thyroid symptoms as well.
they can all kind of crisscross and
Mm,
masquerade as each other. Sometimes if your brain is overwhelmed and has difficulty processing information or can't process stimuli, because say your brain is getting exposed to mold and mycotoxins, then when your brain gets tired, your body is going to feel tired and it's going to feel like your thyroid. But it could also be that your brain is just having processing difficulties, and because of that it's making your entire body feel tired.
right. Yep. Okay. And because I mean, I do know, just even anecdotally talking to people in my, thyroid community, there are a lot of people that have in the process of being diagnosed with usually Hashimoto's
Mm.
and hypothyroidism are told, you've just got depression, go on an antidepressant.
Mm.
That seems to happen a lot. There's a lot of people that
Horrible.
struggle to get a thyroid diagnosis. Your thyroid's fine, TSH is okay, you don't have a thyroid problem, you just take an antidepressant or, and it is sort of almost trivialized like that, I think, for a lot of people's experience. And so do you see that people who may have an underlying thyroid condition not really know, but are being diagnosed with mental health, conditions,
Mm.
and there is this sort of masking or underlying thing that's not being picked up? Do you see that?
Absolutely. And I think
Mm,
one thing that I always say is the body is this complex system,
mm,
and we have to be careful to not oversimplify and think,
sure.
well, because something looks normal enough, then it must be that the person is just depressed. And again, well, what is depression?
Mm-hmm.
Because do we put somebody on an antidepressant if they're depressed, or do we look at their gut health and their gut microbiome and inflammation coming from their
Mm-hmm.
gut that's affecting their brain,
Well, that would
that's
be good.
leading
Yeah.
to those issues?
Mm,
So I think I think where people sometimes make mistakes is they think that, oh, let's find the one explanation for why everything is happening. But the body
mm-hmm.
isn't like that. The body could have multiple stories happening at the same time. You could have leaky gut with brain toxicity because of toxins getting through the leaky blood-brain barrier, but you could also at the same time
Mm,
have difficulties with thyroid health. And like I was saying, that 20% of thyroid hormone is converted from T4 to T3 by the gut microbiome. If you have a dysbiosis, an imbalance of the gut microbiome that leads to leaky gut, it's going to affect your thyroid hormone conversion, reducing the bioavailability of T3. And then if you have leaky gut, you also have a leaky blood-brain barrier. So you're going to be this mentally foggy, tired person that
mm-hmm.
is maybe bouncing around. If you're in that borderline place where your numbers
Mm-hmm.
still look normal enough so that a regular doctor is going to tell you that you're fine, and you just have to go on medication for this or that, because unfortunately, the Western model treats symptoms but doesn't always look at underlying root causes.
Mm-hmm.
So it gets you see it becomes like this big domino effect,
Yeah.
and it's much more complex and it can feel really overwhelming. But if we dial it back down and simplify,
Yeah.
really what I'm saying is, regardless if your thyroid is off, your brain function is not perfect, or your brain is inflamed and you're experiencing depression, anxiety, or a combination of both, that the simple thing is go look under the hood, see what's happening
Yeah.
with your gut. If you have not paid attention to your gut, then go back and make sure that you're working on your gut health. Rule out that there's dysbiosis, yeast overgrowth, parasites, leaky gut, poor production of an anti-inflammatory short chain fatty acid from the gut microbiome, butyrate. Like there's an entire ecosystem, almost like a rainforest, that needs to be balanced there. And it almost in many ways can supersede. And the very interesting thing about working with gut health is that a lot of times some things will get better that you don't expect to get better
Mm.
just by starting by working with the root system first
Mm-hmm.
and
Okay.
then
And so,
going from there.
would you, I mean, are there particular sort of tests that you would suggest that people look into in terms of understanding what your gut is doing, or is it, is that a good place to start?
It's a really good place to start, and it's
Mm-hmm.
also important to understand that not every test is the same.
Mm-hmm.
So you might go to your doctor and get stool testing, but that stool testing might not be comprehensive enough.
Mm-hmm.
And there's definitely like some really fancy gut microbiome tests now that you can run. We also have to realize that we're still discovering what can be extrapolated from a stool PCR test showing you what the makeup is of your gut microbiome, and we can see there are good guys, bad guys, but we still need to understand, well, how does this entire thing work together? And that's where it gets quite complicated. But yeah, stool PCR testing, looking at inflammatory markers in the gut like calprotectin, fecal lactoferrin, fecal eosinophil protein X. Eosinophil protein X, when it's high, can signal food sensitivities, which are very commonly associated with autoimmune thyroiditis,
Mm-hmm.
as well as parasites. Looking at secretory IgA, which is a type of immunoglobulin that's secreted in the gut, to see what are the levels of secretory IgA. Are they high, signifying that your body's trying to fight off and protect itself from something in the gut? And then
Mm-hmm.
putting all of that information into the matrix of the person, how are they presenting, and integrating, not just looking at the test result isolated from the person, but putting the test together with the person, the story, and understanding the whole, looking at potential reactions to different foods like dairy and gluten being a really big one with people with autoimmune thyroid disease,
Mm-hmm.
and seeing if there are modifications that need to be made in the diet while working to heal and seal the gut lining and reestablish balance in the gut microbiome.
Mm-hmm.
Because usually the person who's arrived at this point in their life where they have thyroid issues, they have a story to tell.
Yeah.
Then in that story, maybe they had stressors, maybe they were exposed to antibiotics, maybe they were exposed to some sort of toxins, maybe they suffered from chronic constipation. So there's a lot of hints that can be uncovered from the story itself, combined with the testing. And there's a lot of different fancy testing that can be done. But I
Yeah.
still, for years, just found that you don't want to throw out the baby with the bathwater. You want to make sure that you honor the story that the person is telling you, because there's a lot
Mm-hmm.
of truth in there, whether or not you find all of the answers in the tests.
Right.
You have to always
Okay.
integrate the answers between the two, as we know that testing ranges have changed over years, like even the
Mm-hmm.
optimal TSH range
Yeah.
has changed a lot.
Mm-hmm.
And that just shows that we were just making incorrect assumptions about what hypothyroidism was. And if we go back to the 1980s, a lot of women were having to suffer with low thyroid function, but being told they were fine because the Endocrine Society had the TSH level set so high as a threshold for
Mm.
hypothyroidism that we were missing a whole segment of women that had hypothyroidism.
Right. Yeah. Yeah. Okay. Yeah. So, I think all of that just confirms what I've often said and had conversations on this show, is it is so important to work with a knowledgeable practitioner, an integrative health practitioner, ideally, who understands all these interconnections and who will sit and spend the time with you to hear your story, because that doesn't happen in your average GP office, not here in Australia in 10 minutes. I'm not sure what it's like over there, but certainly doesn't happen.
Not in the US either,
No.
15-minute visits, and
Yeah.
yeah, and it's important. We're in kind of an interesting time in the world. The internet has created this plethora of information. It has democratized information. If you think about like
Mm.
pre-internet era, health knowledge was protected by doctors, which was a very patriarchal society of, telling you what to do
Mm.
and just being told, well, just take this medication and you'll be fine. And it was very disempowering to patients. So the last 20 years have been like patients taking back their power. But at the same token, what I've seen is that now we kind of have tipped the scales, and we're
Mm.
in an era of information overload,
Yeah.
and it gets very confusing.
Yeah.
And I like to think of what Mary Morrissey says, that you can't see the picture when you're inside the frame. When you're the patient and you're trying to figure yourself out, and you're
Mm.
spending hours and hours doing Google research on the internet, looking up things, but you're inside your frame, you can't objectively see the whole picture.
Yeah.
So you really need somebody from outside of you that can come in and see the patterns. And
Mm-hmm.
I mean, over the years, I've seen very educated people, like wonderful people. They do so much research, they know what they're doing, and yet everybody has a blind spot. Everybody has something that they have missed that is driving their disease. And what I love about the work that I've done over the years is and especially because I see patients that have been to multiple doctors, have tried multiple things. So I was always in the position of asking, well, what else? or what has been missed here? Because
Yeah.
somebody did an amazing workup. Like, if I would have been the first doctor, this is what I would have done. But it really forced me to look at, like, what is missing here? What are the
Mm.
unturned stones that have not been looked under, that is driving this person's disease presentation?
Mm.
And it's
Yeah.
hard to do that on your own.
Yeah.
And as smart as we all are, it's hard to not have a blind spot for yourself.
Yeah.
You
So
know,
it's
we,
both, isn't it? That's you be educated, but get that professional help so that, I mean, I mean, I'll use myself as an example. Like, I've done a huge amount of reading, talked to lots of amazing people, but when I go to see my doctor, she's like, "Yeah, but Annabelle, your body does this, 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 and this. That's why I'm doing that." Okay, that makes sense. And so, sometimes I say, "But what about this?" And she's like, "Yeah, you're asking kind of the wrong. Yeah, I see where you're coming from, but it's not quite the right question because." And so I think, yeah, okay, I can be guilty of the same thing. Getting overwhelmed, and often when I talk to lots of different guests on the show, I'm like, oh, I've got to try that, and I can find myself going down different rabbit holes, and so I've got to rein myself back in too, and say it's one thing to be informed, and I think that's so incredibly helpful. But that's where finding the right doctor, which is, I know, for many of you listening saying, "Oh, no, but that's impossible," or "I live in a regional place and it's next," there's lots of different barriers, but keep going, keep finding, because I think there are an increasingly good integrative doctors around, but you're going to have to travel or go online and pay. But it is, yeah, for all the reasons you've just said. I really like that. We've got to, as
I,
patients, find out, trust someone to see the blind spots and help us.
what I do think that people have is that even with blind spots, they have their intuition,
Mm-hmm.
and they can intuitively know if someone is taking them on the right journey, or if someone's taking them
Mm-hmm.
on a journey that just doesn't feel right for
That's
them.
good. Yeah.
And that's really important. And another thing is, like, learning to, like, a lot of the work that I do with patients is teaching them to listen to their bodies,
Mm-hmm.
and to be able to ask their body for the answer for something. Because when we listen to our bodies are usually speaking to us. It's just a lot of times we're ignoring the signals, or we
Mm.
don't know what signal to pay attention to. It's kind of refining the antenna and
Mm-hmm.
realizing, because so many people with thyroid issues have food sensitivities of all types or have low
Mm-hmm.
stomach acid.
Yeah.
So maybe they realize, every time I eat certain types of foods, I don't feel so well in my
Yeah.
stomach.
Yeah. And
Or
yeah. 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 Sorry.
it's really dialing in on your own intuitive knowing,
Mm. Yeah.
and
Yeah.
recognizing that even while being within the frame, I think we can expand upon our own intuition to really sense what our bodies are telling us.
Mm. Yeah. I know I've certainly had to do that over the years. And I mean, maybe that's where we can talk for a minute around, if we're wanting to feed our gut with the right things, so that helps our brain health and our mood management, and avoid the things that aren't good. What would be? I know for me, some of the. I mean, I don't do gluten. I don't really do grains, dairy. Different times when my gut health has not. It fluctuates. I've done no coffee for 12 months. I've tried. I've done no nuts for periods of time. No eggs. Some of those things vary, and I can let things back in and out. But are there key things that you would say, I guess, are common culprits, that aren't going to be good, or maybe good starting points to tune into?
Yeah, and these are general recommendations.
Yeah.
Things can vary depending on the person and
Mm.
how the person responds to things. So there has to be a lot of inner listening. But like you said, gluten is a big one because gluten activates zonulin, which then increases intestinal permeability, which then leads to things that can aggravate thyroid and also cause dysbiosis. A lot of gluten wheat is contaminated with pesticides, with glyphosate.
Mm.
So then we have to deal with the antimicrobial effects of these pesticides on the
Do you
gut.
think, can I just ask a quick question around that?
Yeah.
Because a lot of people will say, well, you can eat the gluten in Europe because it's not sprayed in the same way, or it's okay if it's in sourdough because it's been fermented. Do you have an opinion on those
There's a
two
lot of nuances
things?
with
Mm.
that. There's a couple of
Mm.
different nuance things to think about. One of them is that the yes, the wheat in Europe might not be sprayed with glyphosate, right? Because they have stricter guidelines.
Mm-hmm.
Whereas the wheat in the United States, a lot of it is this dwarf wheat, gets sprayed with glyphosate. It's also this hybridized wheat that is much higher in gluten than regular wheat. It's like 30 to 50% higher
Right.
gluten, which we just have not evolved at the rate where we can break down that much gluten. So
Mm-hmm.
in Europe, in some European countries, they're using more of an ancient wheat that doesn't have as high levels of gluten. It's
Mm-hmm.
not sprayed with pesticides. So I have had patients who will go to Italy and say, I felt fine in Italy. And then when I come back to the US, I don't feel good. They're like, well, I was fine in Italy. Why not try it again here? Well, a couple of factors. One, when you're on vacation, you're more relaxed.
Yeah.
And if your nervous system is relaxed, again, thinking about what we were talking about, gut brain connection, vagus nerve, when you're more
Mm-hmm.
relaxed, you're breathing easily, your ventral vagus is
Mm.
more activated, you're going to digest better.
Mm-hmm.
So you're less likely to have a reaction. And secondly, when they, secondly, you're not getting exposed to the same level of gluten, for example. So that makes a difference. You asked about sourdough, and
Mm.
I think sourdough needs to be nuanced because a true traditional sourdough is fermented for 72 hours.
Right.
Whereas the majority, like if you're going to the supermarket and you're buying sourdough bread,
Mm-hmm.
maybe it's been fermented for 12 hours and then they've pumped some air into it to give it that sourdoughy look with a lot of the air
Mm-hmm.
holes, but it's
Mm-hmm.
not fermented for those 72 hours. And that longer fermentation, what the bacteria do is they are actually breaking down the gluten molecule. So then
Mm.
it becomes much more digestible. Now, is this going to work for everyone who is gluten sensitive? Some people, yes. Some people, no. I've had patients fermenting and making their own sourdough at home, following the more traditional French method, which is 72 hours. And they're able to eat their homemade sourdough, but they can't eat like a commercially bought sourdough because,
Interesting.
again, they're always cutting corners. It's not going to have, and sometimes if you look at some of the breads out there that are commercially made, they're actually adding wheat gluten on top of wheat flour to make
Oh,
it
right.
very bouncy and give it that very
Yeah.
bread-like quality that people love, but don't realize that it's actually worse for you.
Interesting. Yeah, no, thank you. That was interesting because my husband the other day was like, I've listened to this podcast and if you could eat the sourdough, and I'm like, oh, I'm not sure about that. I'm not sure if I want to risk it, but I'll have a think
Maybe
about that.
experiment with a sourdough,
Mm,
a sourdough starter, and ferment your own sourdough at
mm,
home with a longer fermentation. That might
mm.
be okay. Again, it won't be okay for everyone. So
Yeah,
there's a
yeah,
lot of individual variability with that. We were talking
yeah,
about some other foods that
yeah, yeah.
are not great for patients with thyroid issues.
Mm-hmm.
Dairy is
Yeah.
another one.
Mm-hmm.
A lot of times there could be reactions to lectins, so have to pay attention to soy and beans and foods like peanuts. Peanuts also are contaminated oftentimes with mold as well.
Mm-hmm.
And
Mm-hmm.
and I think something that people don't think about, but is something that a lot of people consume on a daily basis and may not think about its potential toxicity, is coffee. And you mentioned
Mm,
going on coffee, off
mm.
coffee.
Yeah,
I
yeah.
actually was off coffee for 7 years and then recently started drinking coffee again, but only a non toxic, clean, low acid coffee that is free from mold, mycotoxins, pesticides, and heavy metals. And I think that
Mm-hmm.
makes a big difference because even heavy metals are going to affect thyroid function because they affect
Mm.
mitochondria. And there
Okay.
was a report last year that certain chocolate bars are contaminated with either lead, cadmium, or
Oh
both.
gosh. Oh gosh. Wow.
This
Hmm.
was in Consumer Reports, and we wrote a blog post about it in 2023 about
Hmm.
heavy metals in dark chocolate, which you wouldn't think because some of the brands are brands that are everyday brands that I
Mm.
would even buy. I was quite shocked and had to
Mm.
change my being a chocolate lover, had to change my chocolate buying behavior because of it.
Mm. So the coffee, like if you can, and I know you've developed a coffee so that it is, you know, low acid or the toxic free. So I think if you can make a really clean coffee, then that should reduce the negative side of coffee on your gut. And yeah.
And even just on the hypothalamic pituitary adrenal axis and how a lot of coffee can drive
Mm.
cortisol,
Mm.
uh, which then actually causes more exhaustion, right? Because
Mm-hmm.
you get that peak of energy and then you crash
Yeah, that's what
afterwards.
happened to me after I gave up coffee. It made it. I noticed it in my gut, but I'm more noticed it in my energy. I really increased my energy within about a week, and I didn't think I was drinking that much coffee. But yeah, and now I sort of I've got a local product here called Not Coffee. That's not coffee, made from chicory
Okay.
and carob and something else. A girl in Melbourne developed that, so I'll have that, and have introduced coffee a bit more. So yeah, I totally can. I've experienced that. You think I'm having the coffee for the energy, but you go off it and you've got more energy.
Yeah, and that's something that I've experienced, and also coffee as a potential trigger for migraines. So when
Mm.
I developed this coffee I call Happy Gut Coffee, that is free of toxins, and it's also a dark roast, which makes it lower acid and also reduces the caffeine content, so it's not as high
Mm.
in caffeine as regular coffee.
Mm.
I found that it doesn't give me that accelerated drive that usually caffeine would do for me, because I'm a slow metabolizer. So caffeine
Mm.
sticks around in my system for a long time. And normal espresso, or even just picking up a coffee out at a store, um, it it will make me feel like I'm amped up. I feel like I've been
Mm-hmm.
drugged. And so when I decided to come out with this Happy Gut coffee, I was looking for not just something that would be gut friendly, but something that would also not cause an energy crash like
Mm.
other coffees have done to me and do to a lot of people. And the
Mm.
amazing thing with this is that I don't feel that peak and crash. And I think a lot of times that what we're calling what we think is the crash from coffee could actually be adrenals. It could be the way the coffee is stimulating insulin. But another thing that people don't think about is that it could be toxins in the coffee, because coffee is one of the top 10 most pesticide sprayed
Uh,
crops in the world. And up anywhere around 50% of coffee can be contaminated with mold and mycotoxins, depending on the quality of the
mm.
beans. So we source our beans from organic farms in South America, and then the beans get micro roasted in the lower Hudson Valley to make sure that the beans are not burnt ever, because that's also
Mm-hmm.
really important in the process. Anything that you burn then develops these advanced glycosylation end products, ages, which then cause oxidative stress in the body, and they're going to
Uh-huh.
age the
Okay.
body.
Yeah.
So
We don't want to be
you have
drinking
to be
coffee and aging.
no, you don't.
We don't
You
want
don't want to be drinking
that.
coffee and aging. You don't want to be drinking coffee and getting headaches.
Yeah.
So I've actually been converting people who were avoiding coffee to start
Mm.
drinking Happy Gut coffee, because of the fact that it just gives you that even energy. It doesn't make you feel amped up.
Mm.
And hopefully more people will be interested in getting it. We have a Kickstarter
Yeah.
campaign going on right now
Uh-huh.
that is hoping to get more support from people to help us get this coffee out into the world. I think it's really important for people. And if they go to happygutcoffee.com, they can find out more about it.
Excellent. So yeah, definitely do that. And is that available in the US? I guess not just in the US
It's available in
for
the
now.
US, and
Yeah.
we also will ship to Canada and the UK once the
Excellent.
Kickstarter
Yeah.
is done. So the Kickstarter goes until November 22nd.
Mm-hmm.
And if we get fully funded, we have a fundraising goal, then within a couple of weeks later, we'll be able to start fulfilling the coffee and shipping it everywhere. We have the coffee ready to go at this point.
Yep.
So we're really excited to just get more people to try it. I think the flavor's amazing. The gut brain benefits are really good, because when a coffee is high in polyphenols, and antioxidants, which happens when you don't burn it, you
Right.
roast it the right way, then that
Mm-hmm.
enhances that gut brain connection.
Mm.
So there's a lot of great benefits from it. They found that polyphenols actually help stimulate the release of GLP-1, which is the hormone that controls satiety and helps you not overeat, right?
Uh-huh.
And helps with metabolism.
Yeah. Well, look, if you are listening in America, Canada, or the UK, get onto it because I love supporting new. Personally, I love supporting new products, people that have put the time and energy and effort into developing healthy products. I just think is really important to support. I think that's why in Australia for now, well, we can't do that. Like I like the Not Coffee, and I've spoken to that Silla who started that. I just think we should be supporting people who put the time and effort in, and for our benefit. So yeah, get behind the
Yeah, I
Kickstarter
wanted to come out
program.
with
Yeah, I think
a
it's great.
healthier coffee that is not a coffee alternative, because a lot of people still want to drink coffee.
And that's true.
And
Yeah.
and if they go to the page at happygutcoffee.com, what they'll see is we have video of people reacting to the coffee.
Uh-huh.
I was in LA, and I had the opportunity to go to a pre-Emmy Awards event, and I had a bunch of celebrities try the
Oh,
coffee
fun. Yeah,
so they can
awesome.
see their unedited reactions, because everybody, when they taste the coffee, is a bit surprised. And I know if you've never tasted
Mm.
something, you're wondering like, well, should I order this? I can tell you that the comments that we've gotten is notes of cinnamon and chocolate, and with a nutty finish, no bitterness, and a slight, almost like a hint of sweetness, even though we don't
Mm.
add any sugar or sweetener to the
Yeah,
coffee.
yeah. Sounds great. Excellent. So yeah, definitely check that out. And Dr. Pedre, is there anything else that I haven't asked you that you think in this context of gut, brain, mood, thyroid, that the listeners, that you're thinking, oh, Annabelle, you didn't ask me this, or any last, tips
I do
or
I I do want
yeah.
to mention something I think is super important for anybody who's listening and wondering, well, how can I optimize my gut brain connection so that I can feel healthier?
Mm-hmm.
One super important way is like activating the vagus nerve, the ventral vagus.
Mm-hmm.
And one of the best ways to do that is through breath work, through breathing. So you have something free that you carry with you at all times that can help activate your ventral vagus and put your body into that more relaxed rest and digest state that is so important for healing, just by doing deep diaphragmatic breathing.
Mm-hmm.
So that's one. I want to make sure that everybody who listens takes that
Mm-hmm.
away.
Yep.
Other things that help with relaxation, like yoga, meditation, Tai Chi, Qigong, all these things help to activate that ventral vagus that's
Mm-hmm.
so important for health. Then, third is food wise, making sure that you're getting fermented foods.
Uh-huh. Yep.
So it can be in the form of yogurt, and it doesn't have to be dairy. It could be like goat yogurt, or it could be coconut yogurt, or kefirs,
Yep.
yogurt drink, as well as any other types of fermented foods. Think, when you're eating ferments, you're supporting the gut brain connection because you're supporting the diversity of your gut microbiome. And the more diverse the gut microbiome is, the more of
Yep.
those really important nutrients, postbiotic nutrients, it's going to produce that are going to help activate and send signals from the gut up to the brain through that vagus nerve to then regulate the way the brain regions are working in
Mm.
ways that can help reduce stress and anxiety. And I would say food wise, last is fiber, like making sure to get enough fiber in food,
Mm-hmm.
because that also helps support the diversity of the gut microbiome along with the fermented foods. So I
Mm-hmm.
just wanted to make sure that we leave people with these little,
Yeah.
like, very easy action steps that they
Yeah.
can
Yeah.
do,
Totally. Yeah.
where they can really start to work on that gut brain connection and improve the way that your gut is talking to your brain, and as a
Mm.
consequence improve your brain health as well.
Yeah, that's great. Yeah, I like that. Positive and practical is sort of one of the key thing with the Let's Talk Thyroid podcast. And so, yeah, I love it ending on that note. And often what I will say is just, if you've heard a lot in the last hour or so, just take away one thing. Sit and think now, what's the one thing I'm going to take away from this conversation that you can action? Yeah, because you're better off to do one thing than to think you're going to do 10 and do none. So I think
I love
just,
that. Yeah, I call
pick
those
one.
stepwise activations. Like,
Yeah,
choose the
right.
thing that
Excellent.
you're going to master and
Yeah.
just climb one step at a time. Don't try to jump up 10 steps all at once. Just climb
Mm,
the step that's right in front of you, master that, and then get to the next step and the next step. And that's what
excellent.
ensures greater success.
Absolutely. Be the tortoise, not the hare. So, Dr. Pedre, tell us a bit more about where people can get in touch with you, work with you. I know I mentioned right at the beginning your two books. I'm assuming are at least available on Amazon and other online book sellers. But yeah, tell us a little bit more about if people want more of you or to work with you. Where do people go and what do you
There's
offer?
A lot of places where people can find me. They
Yep.
can go to Instagram. I have a big following there at
Mm-hmm.
Dr. Pedre, DrPedre. We put a lot of free content there, like free,
Mm-hmm.
easy to consume content with advice around gut health and wellness. And they can also visit, of course, happygutcoffee.com to learn more
Yep.
about the coffee that we're hoping to bring to the world and
Mm-hmm.
share with as many people as possible. My books are available in Australia, in the UK, in Canada, and all over the United States through Amazon, through all types of online booksellers.
Yep.
My first book, Happy Gut, and my second book, The Gut Smart Protocol. And geez, that there's so much information there to share. I also do a lot of blog posting and education around gut health on my
Mm.
website, happygutlife.com.
Yep.
So there's a lot of places where people can get free information. And if they want to dive deeper and work with me, they can find ways to do that through those websites.
Excellent. Well, thank you, Dr. Pedre. Thank you for your time and sharing all your expertise. And, I love, like you said at the end, just leaving on a really practical note. So, yeah, I want to say a big thank you and, look forward to staying connected. And, it's one of the things I do like about this online health space is, it's just, you meet some amazing people. So thank you.
Thank you.
Thank you so much for listening to this episode of Let's Talk Thyroid. If you have enjoyed the content, or perhaps you're thinking, oh, my mum needs to hear this, or my sister, or my bestie, I would love it if you would share this episode with them. That really just helps spread the positive and practical message of Let's Talk Thyroid and helps that broader thyroid community, our friends and family, to live well with their thyroid health. So you can just, share the episode. If you subscribe on whatever platform you're listening to this podcast, it's free. It's really helpful because then you'll be notified every time a new podcast comes out, and it just makes it much easier to find. There's usually a little subscribe button or a bell or follow often is the terminology. So if you wouldn't mind doing that, that would be helpful. Of course, if you want to leave a review, even better, just a sentence or two about how the podcast has helped you. You can definitely connect with me via letstalkthyroid.com. That's where you'll find access to my book, my coaching, my freebies, and really everything that I offer in terms of thyroid support.